How to clean a hospital bed. It's very important to wear protective clothing, and one of the things that we've put at the beginning of this video is an important warning sign to make sure that you wear overalls and aprons, gloves and such like that are needed, and this can be done with a spore clean or with a chlor wash. On this particular video we're using disposable cloths in a solution of chlor clean, and we've raised the bed up and doing it with the mattress on. Some people take the mattress off the bed, and that's quite alright if you so wish to. The only thing is if somebody's been infected in the bed and you know, we're trying to clean this, you don't want to take the mattress and transfer that somewhere else. So if you're going to do it, clean the mattress before you take it off. But we're going to show you how to do it with the mattress on the bed. So we've raised the safety bars. We're doing the safety bars. After we've done areas, we will be disposing of the disposable J cloths that we're using. Different hospitals use different methods. You'll notice that one of our operatives here is wearing a apron and scrubs, and the other has scrubs with a disposable all-in-one suit over the top. So going down the sides of the bed, making sure you get around everything, including the controls and the wire for the controls. A lot of these beds obviously lift with electrical equipment. We've pulled the bed slightly out from the wall. The bucket that we're using in this case is just slightly off screen, and every time we change our cloths we will be disposing them into clinical waste bins. So we're shooting from different angles to show you the best way to do this, and you won't always see us changing cloths as we go off screen to get another cloth. Right, the heads of the beds are very important. Some of these heads and footers of the bed actually lift out, and you can lift them out and clean them and put them back in. With this particular bed we will show you how to do a minimal lift, because a lot of people can't hold the weight of the end of a bed. So remember to do the box that lifts off. This box is where they put all the medical papers and such like. Remember, these have been handled by clinical staff and need to go back on the bed for the next patient, and it's really important to make sure that's completely wiped down, because doctors that have been treating, or nursing staff that have been treating patients, will have handled the paperwork going in and out of the box that hangs on the end of the bed. Remember to do the wire that goes to the wall socket. A lot of these beds have battery units in them, but still need to be plugged in for using. So we are removing the mattress from the top half of the bed and cleaning underneath. I'm going to drop the safety barrier to show you. Some of these metal units can lift out. You can clean them from the lifting out. We're actually going to leave most of it in situ and do it from underneath the bed as part of the cleaning regime. A lot of nursing staff don't go to this this length when they're actually cleaning a bed space down, but we're going to show you in as much detail as we can how to successfully get all the corners and edges without dismantling a bed. You know, if you've got other sick patients around and this patient's been moved somewhere else, you don't want to be taking beds apart in a situation where there are other sick patients around. Some rooms are too small as well. So cloths get changed on a regular basis, and I'm just showing you here the getting in and out of every single groove. Some of these are repeat shots from different angles. It doesn't necessarily take you this long to do a bed, but in all, with one person and 10 minutes to do a bed should be ample time. However, that's not always the case. It depends on the state that the bed's in. So, giving the underside of the mattress a wipe and the sides. These sealed mattresses can go out for steam cleaning and such like, but when you're doing a spore clean or a chlor clean, just give the bed a good wipe. So we've lifted the top half, now lifting the bottom half, and you can get a better view of the underside of the bed, getting around all the nooks and crannies of the bed. Obviously, if somebody's been on the bed and has had diarrhea or a weeping wound of some sort, you can get seepage run into the side. So here we've got the bottom side of the bed and the underside of the mattress being wiped, and it's important to get it everywhere with this. With a spore clean, you'd obviously use sporicidal wipes, and they can be activated under a sink tap, and again you would change those on a regular basis. So giving a good wipe round to the sides and tops of the mattress now. Nursing staff do this on a regular basis when they change sheets and such like, but a good infection control clean would see that these are done in thoroughness. So now when you need to get the bed base to fold, and the reason you do this is so that when you go under the bed, you can get to all the bars and tubes and pulleys and hydraulics that lift the bed. Obviously a patient wouldn't be very comfortable on a bed like this at the moment, but you can see the way that it all folds up, and you can get right in on the underside. It's not necessary to crawl all the way under right at the beginning, because obviously you can get your hand in at different areas. It's a good wipe down to bars and pulleys. Now we're using a chlorine solution, whereas chlorine tabs used in very lukewarm, if not cold water. We don't want to do it in hot water, because all you do is get a room smelling of bleach. Just as active bleaching solution, and put 1 per litre. You'll see that the heads of the beds have been lifted out of their sockets and replaced, and this all goes to help with getting in and out the grooves. So the underside of the bed gets wiped down, and all the joints of the bed lifted up into that position also get done. Remember, when disposing of cloths, it goes into the clinical waste, and that gets taken away and tie wrapped and incinerated or dealt with by the hospital. So fresh cloths are used on each area. With a bed clean of this, you could 15 or 20 J cloths or spore wipes could be used. I wouldn't suggest that any less than that are used. Remember that where the bed joints come together, there's sometimes little bits of grease which need wiping off. The estates department come around every now and again and take beds to check them over, and hopefully there's no grease on the joints when it comes back from them. It's important that you don't bang your head doing this. Certain people I've seen do this have not been too careful and have ended up banging their heads. Some hospitals would take the beds out for periodic cleans and steam clean the wheels and around the bars. Obviously that's not necessary with this here, because this is obviously going to be used for another patient at the moment, and steam cleaning can upset the computer panels that are in the bottom of the bed that control all the lifting and mechanics of the bed. But make sure you go around the casters. Casters sliding backwards and forwards can pick up anything off the floors. It's important also that you check the floor before you clean, because crawling around under a bed, if there has been anything that's spilt on the floor, that can also be picked up by the operative. So once you've put all the done all the bed and bed space, you can then wipe over with fresh cloth the pillows. Pillows tend to stay with the bed, and many of the pillows are wiped over with a bleaching solution. These don't have pillowcases on them. This is the inner part of the cushion, and sometimes with certain patients in certain circumstances, those will be bagged up and sent out to be processed. But if you're going to put them back onto a bed, then make sure they're wiped first. Put the bed back down into the position ready for nursing staff to make the bed, and put the bed back into a good position and lock the brake on. And I'd like to get your comments. If you want any comments, please go to hospitals.co.uk, and we'd love to know what you think to our blogs, and have some input from you.